Hello, and welcome to our workshop on mind-body tools for MS. Multiple sclerosis is a condition that is estimated to affect around 2 million people in the world. Most likely, you're here today because you're either affected by MS or you know someone who is. So, as you understand, it's a condition that can be very challenging. And the symptoms for which there's not necessarily a lot of great interventions available that are highly effective. So we are very honored that you're joining us here today. And this is going to be a very interesting session. And I'm going to let our two guest hosts introduce themselves. But I just want to say that we have a real treat because we are joined by Ardra Shephard today. And she has a really great blend of, humor with her personal lived experience with MS. So it's going to be very delightful for all of you to hear from her today. And with that, I will kick it over to Ardra to let you introduce yourself to everybody.
Thank you, Shelby. I'm super happy to be here and a little bit nervous to be live hypnotized, but I'm excited. As Shelby said, I've had MS for over 20 years. So I'm definitely very familiar with the frustration that comes with managing or trying to manage symptoms that we don't really have a lot of great therapies for. So we do have very good medications now that help, you know, manage relapses and the overall course of the disease. But in terms of symptom management, it can be a little bit trickier. So again, I've had MS for over 20 years. Some of you may know me from my blog, Tripping on Air. I also host a television show called Fashion Dis here in Canada, which is a makeover series that is, I think it's the world's only, certainly first makeover series that is dedicated to people with disabilities and an examination of the adaptive fashion and beauty industry. And I also just published a book called Philosophy. As Shelby said, I try to use humor. I think that there's some definite therapeutic benefits that maybe Dr. Spiegel can explain to us with laughter, but it's really about storytelling and, you know, figuring out what life is in this body with MS. So I am always learning. I am always keen and eager to examine complementary therapies to our traditional pharmaceuticals to help manage the disease. I'm really excited to dig into this with you guys. So that's a bit about me.
Thank you, Ardra. I'm delighted that you're here with us. And I think you need to explain to our good listeners how you spell philosophy
Yeah.
in your book.
FALL. So it's a play on words, right? My blog was called Tripping on Air. Yeah, I think the tagline is something like it's a memoir. It's a book about picking yourself up, if not literally, then metaphorically, at least. There's a lot of falls that tend to happen with MS. Maybe that's something you can help us with.
We'll see what we can do. I'm Dr. David Spiegel. I'm a professor and associate chair of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. I've devoted my career to studying and understanding mind-body connections. I run a center on stress and health at Stanford, and I also run our Center for Integrative Medicine, where we use techniques like hypnosis, which we will show you about today, and mindfulness and functional medicine and acupuncture to help people use their minds to help their bodies. And one of the perspectives I have about MS that I hope to share with you is that MS it's a complex and difficult disease, multiple lesions in time and place, autoimmune attacks on the myelin sheath and neurons. But that's the bad news. The good news is you've got a whole lot more neurons in your brain than you have that are being attacked by the disease at any one time. And so the issue is how to mobilize the rest of them to help you live better, even though you've got some that are not firing properly. So that's what I hope to help you do. And hypnosis is just a state of highly focused attention. The closest thing you may have experienced to it is getting so caught up in a good movie that you forget you're watching a movie and you enter the imagined world. It's been called believed in imagination. And it's a way of helping you to decide what to focus on, and by inference, what not to focus on. So you focus on what you're for, not what you're against. And as an example, right now, you're so fascinated in listening to me that hopefully you're not aware of the sensations in your body's touching the chairs you're sitting in. If you were, you have my permission to leave now. You're bored already. But in fact, our brains are always making choices about what to pay attention to and what to ignore. And there are things that you can do to mobilize your brain to pay more attention to what you want to focus on. And that's what we'll be discussing.
I think that's super interesting because when you say, if you are paying attention to what your body feels and not listening to what you're saying, that feels like a particular obstacle to overcome with a disease like MS, where when we are kind of always aware, or at least I am, of pain sensations or checking in with my bladder, do I need to pee? And I think it can also be a vicious circle of repeating these habits. Does that make sense?
Well, I would say it can be, sure. You can be distracted by it. You can pay more attention to it than it deserves. But with pain, for example, unless you've just recently sprained your ankle or something, that pain information is not all that useful.
Yeah.
And it is entirely possible to discipline your brain to filter the hurt out of the pain, to decide, I'm going to pay attention to something else. I know it's there. It's not news. I don't need to pay any more attention to it. And we did an experiment where we took Stanford undergraduates who were highly hypnotizable, gave them some shocks to their wrist that were slightly painful, more painful than listening to one of my lectures. And we then, in one condition, hypnotized them while we were recording electroencephalographically the brain's response to those pain signals. And they were cut in half from within a tenth of a second. So the brain was acting as though the same pain signals were just not as bad, not as interesting, not as important. So the brain is actually a very good modifier of sensory input. And the story with pain is both the aberrant signals from your nerves, but also how much attention the brain pays to it. And there are times when you want to pay attention to things. So I contrast that, Ardra, to whether you need to check in with your bladder to see if you need to pee. That's good to know because it gets unpleasant if you don't. So I would say, train your brain to pay more attention to when you got to go to the bathroom and less attention to that same pain signal that is not telling you anything new.
Okay, that's good advice. I think with MS, it is a disease of the central nervous system, the brain, the spinal cord. So I like to say whatever can go wrong might go wrong. And I feel like what you're saying, the good side of it being the brain being involved, is that we can actually have some influence on that, which
That's right.
I think is really exciting for people with MS because it can feel like a disease where we've lost a lot of control. And so it's exciting to me to think there are some things we can do to help us empower and feel like we have a little bit more control over our bodies.
That's well put. And that's exactly right. That just because, it's sort of like kids in a classroom, there may be one or two who are running wild, but you don't want them to take over the atmosphere of the classroom. You don't want to pay attention to the noisy kid. And in a sense, it is true that some parts of your nervous system are not functioning properly. So your challenge is to make it a challenge and to say, okay, I know this is happening. What can I do to get the rest of my neurons doing what they can do to help me feel less pain, help me be more aware of something I need to be aware of in my body, and make it a challenge rather than just, oh God, here we go again. Because that's often what happens with people with chronic pain, for example. People get angry, people get frustrated with their bodies. And what I tell people in hypnosis is to treat your body as if it were your baby. Do you ever get angry and frustrated with your baby because they're crying or they hurt themselves or something? No, what you do is you soothe them, you calm them, you try and make them feel better. And that's the kind of relationship I would want to help you cultivate with your own body, is to have the same compassion for your body that you have for your kid.
That's really great advice. And it makes sense to me how we can have an impact on pain that's not serving us. Can you talk about how these techniques might help with other MS symptoms? So many of our symptoms are tricky to treat, right? Fatigue, for sure, is one. Balance, I would say, bladder and bowel problems that I alluded to. How do these techniques address, I don't want to say that more physical, less psychological? I know pain is a physical symptom too, but this nerve pain can feel psychological.
Yeah. Let's say fatigue is one example. I know MS patients who, the tendency to think is, oh, I'm tired. I'll just, lie down and wait till it goes away. And another approach is to say that's a challenge, that I'm not using my body in the most productive way, and to challenge the fatigue, to say, okay, I'm tired, but I don't want to let this mess up my day. And I want to get out and take a walk or do whatever I'm going to do, and view it as something to be dealt with rather than something to yield to. So think about your strategy in dealing with fatigue. And maybe it's a sign that you need more activity, not less. So obviously you don't want to push yourself beyond what your body can do. But at the same time, fatigue is just a signal in the brain like pain is, and you can either pay more attention to it or less. So I know people with MS who have sort of conditioned themselves to view things like fatigue as a challenge to be overcome, not as something to give into. And there may be some circumstances where that's not a good idea, but I think there are some where it is.
I think it's a learning curve for all of us with MS of figuring out what our thresholds are. And they change constantly every day. Can self-hypnosis help with things like mobility and balance?
I think it can. Obviously, I don't want you to push yourself out onto a tightrope if you're not feeling up to it.
Don't give up your mobility aids, right? We don't want to be responsible for any broken bones.
No, we don't. But it's something where I would view it as a challenge the way anybody who's getting older has to be careful. You don't have, you lose fast muscle fibers. We all do as we age more than slow muscle fibers. So the kind that you could just contract and catch yourself if you're losing your balance, you have less of those and more of the slow reacting fibers that are not as quick to help you maintain your balance. So I would view that as an opportunity to sort of train your body to respond, even if you have limitations. If it's not working as well as it did, try and find that threshold where you can really react if you feel there's a problem with your balance. And just, doing exercises that teach you how to control your balance better. See if you can stand on one foot for a little while. And obviously somewhere where if you fall, you can balance yourself in other ways, but use it as a way of reacquainting yourself with your body and what its resources are, and practice maintaining your balance in situations where you could have trouble doing that.
And is there a component also of visualizing balance that can help?
Yeah. So in hypnosis, I have people go into this state in which they picture themselves somewhere safe and comfortable, a bath, a lake, a hot tub, or floating in space. And picture yourself in a situation where you might feel a little shaky and not sure you can maintain your balance. And picture yourself getting through it and managing it. You might picture yourself, for example, in the shallow end of a swimming pool where you can walk. There's some resistance to the walking, and you could practice this too. And if you leaned over and fell, it would be fine. You wouldn't hurt yourself. So you can be in a situation where you can practice safely, knowing the limits of what your body can do at that particular time. And of course, the thing with MS is, as you know better than me, the story changes all the time. So at one time, you're better at this and worse at that. But it's good to be acquainted with it. Say, I know what my new and old limitations are, and I want to learn how to work around them and make my body work as well as it can. And
I
so
think
that's the challenge. Yeah, sorry, go ahead.
I'm going to visualize myself in a pool wearing stilettos.
Oh, there we go.
That'll be the high heel practice.
That wouldn't have occurred to me, but I'm glad you brought it up.
Dr. Spiegel, I feel like everyone watching probably wants to know if they are hypnotizable. I want to know if I'm hypnotizable.
Yes.
Should we just dive into it? Yeah.
Let's dive into it. That sounds great.
Sorry, before we start, because I know if a lot of people on here who might have MS and upper body weakness. Now, I've experimented in the app a little bit already. And part of this hypnosis involves a little bit of a levitation of the arm And
Right.
I'm wondering how we mitigate that complication for people who might have upper extremity weakness. I know for me, it's like it's challenging even to hold my hands this high for any length of time. And it could very well be much more difficult for others.
Well, that's something where I'll be learning with you, but I want you to see what you can change, whatever the experience of your upper body strength is. But what I do with non-MS people as well is part of the test we call the hypnotic induction profile. You imagine your hand floating up in the air like a balloon, but I ask people to rest their elbow on at the arm of a chair or on their leg or on the desk in front of them. So it's not a big test of strength. It's more position. So when you do the head elevation, rest your elbow somewhere where it doesn't mean you've got to hold your whole arm up, because that gets tiring for anybody.
Right.
Okay. Even me.
Okay.
So, all right. So get as comfortable as you can. Can you adjust the height of your camera a little bit so that your head is near the top of the screen, or is it fixed? Can you do that? I want to be able to see your arm a little better. Good.
Okay.
Thank you. Okay, Ardra. All right. So get as comfortable as you can. On one, I'd like you to do one thing. Look up to the top of your head, all the way past your eyebrows. Keep your head still, but look up. That's good. Keep your eyes up. 2, slowly close your eyes and take a deep breath. And 3, do 3 things. Let the breath out, let your eyes relax, but keep them closed, and let your body float. Imagine you're floating in a bath, a lake, a hot tub, or just floating in space. And now I'd like you to take your dominant hand and stroke the back of the middle finger of your other hand. So stroke the back starting from the tip of your middle finger of your left hand. Good. And stroke all the way back along the back of your hand, past your wrist, along your forearm to your elbow. And as you do that, you'll feel a sense of tingling, numbness, and lightness. And now put your right hand back down and let your left hand float up in the air like a balloon. Good. And let it rest in a comfortable upright position. And I'm going to give you this instruction. Your left hand will remain light and upright in this position, even after I give you the signal for your eyes to open. After I do, when I ask you to pull your left hand back down with your right hand, the left hand will float right back up to the upright position. You'll find something pleasant and amusing about the sensation. After that, when I ask you to touch your left elbow with your right hand, your usual sensation and control will return. Each time you go into this state of concentration, you'll find it easier and easier to do, and you can use it to help you concentrate on what's important to you. Right now, we'll come out of the state of concentration together by counting backwards from 3 to 1. On 3, get ready. On 2, with your eyelids closed, roll up your eyes, and 1, let your eyes open. Ready? 3, 2, 1. Good. Now stay in this position, please, Ardra, and describe what physical sensations you're aware of now in your left hand and arm.
It feels tingly in my fingertips. It feels light.
Light. Good. Is it comfortable?
Yep.
Does your left hand feel as if it's not as much a part of your body as your right hand?
Maybe.
Okay. Well, does it feel as connected to the wrist as your right hand feels connected to the wrist?
No.
No. Good. All right. Now, please take your right hand, pull your left hand down, and then let go. Now, please turn your head, look at your left hand, and watch what's going to happen. Look at your left hand. That's it. And as you look at your left hand, just imagine it to be a big, buoyant balloon. And as you imagine it to be a balloon, permit it to act out as if it were a balloon. Be big about it. Good. Now, leave your left hand up, and by way of comparison, Ardra, please raise your right hand. Put that one down. Are you aware of a relative difference in sensation in your left hand going up compared to your right?
Yes.
Is one arm lighter or heavier than the other?
I would say the left is lighter and the right feels colder.
Cold. Over which hand would you say you have more control right now?
The right.
Right hand. Okay, good. Does that surprise you at all?
A little, yeah.
Yeah. Okay, good. And what's your left hand feeling like now?
It feels chill. It feels good.
Good? It likes being there. Is that it?
Yeah.
It's got a bit of a mind of its own. Is that right?
Maybe. Yeah.
Okay, good. All right, now please take your right hand, touch your left elbow, and then let go. What happened now?
My hand went down.
Okay. It wants to stay down now.
I didn't really want to go down. I think it's like I'm overthinking it.
Is the control equal on the two hands?
No,
No, you still have less control on the left?
I would say it just feels more relaxed.
More relaxed. Okay. Did I do or say anything that would indicate there'd be a change in sensation or control in your left-handed arm?
I don't think so.
Well, why did the control get back to almost normal?
I don't know.
Did I,
feel like I'm failing hypnosis.
no, you're sailing through. You're doing fine. Did I say anything to you about your elbow or touching your elbow?
I did touch my elbow. Yes.
Uh-huh. Okay. And might that have anything to do with the return of control?
Yes.
What was that? Do you remember now?
That was like the return of control happens when your right hand touches the left elbow.
You remember that. Did I say that?
I think so. Yeah,
Okay.
you said that. Yeah,
Did you have a sense of floating lightness or buoyancy in your left-handed arm during the test?
I did. Yes.
Did you have that sense in any other part of your body, head, neck, thighs, abdomen, chest, all over?
No.
Or just your left-handed arm? Okay. Well, that's the end of the test. Your score is 6.5 out of 10, which is very good. So you're moderately hypnotizable. And what you were able to do was change sensation and control in your left-handed arm in response to instructions. So for a while, it felt rather different and then got back to more or less normal again. And so you're able to manipulate control systems in your brain and your body and feel the difference. And so you have a wider range of control options of your body than you might have given yourself credit for.
And it's really interesting because we think of hypnosis, we think of like the TV movie version of like, you're getting sleepy, right? Like, is hypnosis, is our ability to be hypnotized something that we can get better at? Or is it something we can improve if we practice? Like, can we train ourselves and more susceptible to this state of mind?
Not exactly. It's more identifying the ability you have and learning to use it better. I think of hypnosis as an app on your phone that you just haven't used. It's an ability that we have that we don't understand, identify, and make use of. And so we're doing some research on how to enhance hypnotic ability, but the basic story is that in adult life, your hypnotizability is as stable as your IQ. It just doesn't change very much. So people tend to be low, mid-range, or high. On the Reverie app, you can do the test that I just did with you. And we categorize people into three categories. The extremely high people, we call them the poets. They're just in the world of imagination. And highly hypnotizable people just get it with other people. They can see the perspective of another person better than they can see their own. They get caught up in movies and forget they're in a movie and just enter the imagined world. People in the mid-range like you, we call the diplomats. You engage in an experience and then you step back and think about it and wonder what it's like, and then you may try it again. And there are people we call the researchers who just aren't hypnotizable, and it's all logic and understanding rather than experiencing. So you're in the mid-range. You got plenty of hypnotizability to accomplish things. So just as you were able to, are you having any pain right now, or were you when we started?
I have less pain than when we started, when you were talking about focusing on your voice rather than the sensations of your body. So I don't know, maybe more focused in now than I was.
That's very cool. Okay. So what was it on a scale of 0 to 10? What was it before we started?
Oh, probably a 4. I mean, I've always got some little baseline
Or-
pain
Yeah.
happening. Yeah.
And what is it now?
Maybe, oh, like 2, maybe lower
Okay.
even. Yeah.
Great. And we weren't even working on that. Imagine if we actually
No, I
paid
know.
attention. So you see, you have, just as you discovered that you could make your left hand feel different than your right in terms of control and movement, without even trying, you were able to turn down the attention you were paying to pain. You have to pay attention to pain for it to hurt. And you were able to
I
do
like
that.
that phrase, like turning down the attention that you pay, because it's okay. I just, as the like voice of skepticism though, what do you say to people who get a really low hypnotizability score?
I tell them to go away. No, I don't do that.
Get out of here.
No, I just, for them, it's a more cognitive situation and less an experiential one. And so I just say, look, often for people who are not very hypnotizable, who have pain, they get really annoyed. They get frustrated, and they get frustrated with their body. I had a woman the other day who turned out not to be at all hypnotizable, but she was a woman who she was having chronic severe pain, and she looked after animals. She just loved animals. She did it as a career, and now in retirement, she has 2 horses and 4 cats and 6 goats, and she looks after them, and it gives meaning in her life. And I said, if one of your animals were hurting and whining and making a fuss about their pain, would you get angry with him? And she said, no, I wouldn't get angry. I'd help him. I'd stroke him. I'd do something. I said, well, why don't you give the same level of respect and compassion to your own body that you give for any other living creature? And she was a little taken aback, but she said, you're right. You're right. I'm in a different mental state about my own body's pain than another creature's. So for her, it's more a matter of readjusting the emotional reaction to the pain rather than changing the level of the pain itself. Now, you're lucky, you're moderately hypnotizable, so you were able to reduce the pain without even trying. And that sets up the right feedback system, where if you know you have some control over it, if you know you can get to a point where you're not as bothered by it, it will also irritate you less. And you're less likely to get angry and frustrated with your body. Another way you do that is through your sense of humor. You play, you make it a game, you dress in pink, you do all kinds of things that are a way of playing with your body and not taking it all that seriously.
That you say that, I think it's like about the intentionality of creating things in our lives that bring us joy. And maybe that's what you're talking about too, is like switching your focus.
Right. That's exactly right. You're seeing it as a challenge that you can respond to creatively rather than a nuisance that you just want to put behind you and do something else. So if you can do it that way, that will make a difference emotionally and physically.
Can you talk about, because I've been in the app and I've listened to some of these guided, like, can you talk about the difference between meditation and hypnosis?
Yes, sure. A lot of people ask me that, and I have great respect for meditation. It's a long-standing tradition, particularly in the East, that has drifted over to the West and has gotten a great deal of attention. There are sort of 3 major components to meditation. One of them is open presence. So the idea is to just be with whatever is happening, not to try and influence it or fight it one way or the other. And there's some overlap with hypnosis where I'm saying, don't get angry at your body, have compassion with it. But in meditation, you're not supposed to be intentional. You're supposed to just have an experience. It changes the way you are, not what you're doing. It's not this, hypnosis is more, Western. It's like, let's solve this problem. Let's see what we can do to solve it.
Okay.
So open presence, you do a body scan in meditation, which gets you in touch with how different parts of your body are feeling. And you're supposed to develop compassion for other people primarily. But so those 3 components are important, but they're different. And the practice is more time consuming than hypnosis. In mindfulness-based stress reduction, you're supposed to do it half an hour twice a day. And I'll tell you an illustration of the difference. A woman called me because she said, I've been a good meditator for 10 years, twice a day, half an hour, 10 years. I like it. It's helped me in many ways, but I still have my migraines and I hate that. And so I said, well, how does your head feel when you have a migraine? She said, it gets hot. And you do have increases in blood flow in your scalp when you have a migraine, and you have these visual sensitivities as well. And I said, I want you to imagine in hypnosis, you have an ice cap on your head and you feel cool tingling numbness throughout your scalp and filter the hurt out of the pain. And she called me a week later and she said, thank you, doctor. My migraines are gone. I can't believe it. But she said, thank you also for freeing me to use my intentionality. Because you're not supposed to be intentional in meditation. You are in hypnosis. That's what you're there for. So that's the difference.
Thank you for clarifying that. I think that's super helpful. I have often said that the worst symptom of MS is fear. And somebody challenged me on that recently, saying that they thought the worst symptom was guilt. And I think there's some merit to that too. But I think these are techniques that could really help us with those two states of mind also, especially when you talk about, treating ourselves with the same kindness that we would treat somebody that we love and care about going through the same thing.
Well, it's interesting. Fear and guilt.
They're useless, right?
Well, yeah. Well, fear, it's understandable. I mean, there are times, for example, when fear can be useful and productive. That is, for example, to not put yourself in a situation where you might actually fall and hurt yourself. And being afraid of that is not a bad idea. So I don't know about the stiletto heels thing.
I think the fear that when I think about the fear of MS as the worst symptom, it's this idea that you could wake up with a new symptom at any time, right? It's a progressive illness. It's chronic. It's forever. It's the living with uncertainty part that I think can be so toxic when it comes to MS. And so a lot of that getting comfortable with uncertainty is something that, we're not really trained to do. Especially when we're diagnosed, we're taught to, fight this disease. And it's what does that look like,
Right. Well, so what I would advise people to do, and you can use self-hypnosis to do this, is put yourself into a hypnotic state the way we did it. Look up, close your eyes, take a deep breath out, eyes relax, body float. And then practice picturing what you would do if a new symptom came up. In other words, focus not just on what the disease is doing to you, but what you have learned to do in response to the disease. You can picture, for example, things you did that were successful in the past in dealing with another symptom that came up. So it's not just the unknown. I mean, the unknown is sort of known. After a while, when you live with this disease, you kind of know what it dishes out, and it may change. But you also can review what you've done to respond to it.
Yeah.
So it's not all helplessness. It's, taking stock of what you've learned and how you've learned to deal with it. And so for you, the first thing you do is to make a new joke about it, or something like that.
Well, I think I've said this too, is MS gets harder, but it also gets easier. And that's the part where it's I've been here before. I know what to do. When we are looking at exploring this app and these techniques, there are so many MS symptoms that I want to influence and modify. Is your advice to kind of start with one and focus on one, or should we approach different ones at different times?
Well, yeah, I would say, do it as they come up, but don't take it all on at once because it immediately becomes overwhelming. So just pick an example of something you had learned to get around or deal with. And, and remember that MS is a disease, it changes over time, and it sometimes changes for the worse, but sometimes for the better. That something that was a problem ceases to be a problem, or you learn how to handle it. So I would say keep it to something that is manageable. So if it's a new problem, it's a challenge. How did you learn to deal with it? What did you do, or what could you do with a new symptom? Can you give us all an example of how you have learned to master a symptom?
Yeah, absolutely. I mean, I think it's all about, when I was first diagnosed, I went to a seminar where a top neurologist said that the best patient or the patients that did the best were the ones who accepted their diagnosis. And I was kind of outraged. I was like, how can that be? Like, you have to fight, you have to fight. And I was wrong because I didn't understand that what he really meant was to adapt, and that didn't mean giving up. So it's really like not being in this civil war with your body, but finding the solutions, finding the workarounds that help you get through your day. And for me, I don't know, it's been like mobility aids or getting like an espresso coffee maker so I don't have to lift the heavy kettle with the French press that I broke too many times and had to replace. Like, it's all
Mhm.
these kind of little things.
Good.
But how much time, like, do you recommend we dedicate to a self-hypnosis practice per day, for example, if you had to
Well, I
quantify
would
it?
say I would advise you to do it maybe twice or three times a day regularly. Just take a few minutes, in the morning, maybe to take stock of what's new or what's different and then come up with a strategy. So if you want, we could try practicing that and seeing what it's like. And then I would say the nice thing about hypnosis, anytime, as long as you're not driving a car, do it. And if something new comes up, say, I'm going to take 5 or 10 minutes and just kind of face it and figure out what to do. So if you got a new problem or symptom that has come up recently?
I think it's like degrees of all the
All
same,
right.
Yeah, I was dealing with stress, which it feels like so generic. It certainly doesn't have to relate specifically to MS, but like cognition even, I
Well,
think is which I guess you would talk about as focus, but that's a tough one. I have such a hard time recognizing faces lately unless it's
mm,
somebody that I really know. And that is a very distressing, newish kind of symptom for me because it can be really embarrassing, right? If somebody that I see in my building, for example, regularly, and I are saying hi to me and I just act like I've never encountered them before, that's a cognitive deficit that I would really love to help improve. I think fatigue is also a good one to focus on because it impacts so many people. I don't know how many people are kind of dealing with the same cognitive
okay.
that I am. I defer to you, Dr. Spiegel.
All right. Well, let's all try it together. And all of you, if you want to go along with us while we're doing it. So just get as comfortable as you can. On one, please do one thing. Look up to the top of your head. Two things. Slowly close your eyes and take a deep breath. And three, let the breath out. Let your eyes relax, but keep them closed. Let your body float. Imagine you're floating in a bath, a lake, a hot tub, or just floating in space. And then let one hand or the other float up in the air like a balloon. And that'll be your signal to yourself and to me that you're ready to concentrate. Take a nice deep breath in, about halfway through your nose, hold. Now fill your chest completely, and then slowly exhale through your mouth. And again, a nice deep breath in through your nose, hold, expand your chest all the way, and a nice slow exhale through your mouth. And notice how quickly and easily you can use your store of memories, your imagination to help yourself and your body feel better. Now, while your body is floating safe and comfortable, I want you to picture on an imaginary screen one concern you have related to your MS. It could be fatigue, it could be difficulty recognizing people's faces, could be balance or weakness. But I want you to do that while your body is floating safe and comfortable. So you're thinking about it, but not necessarily feeling it in your body. And I want you to divide the screen in half and put that concern you have on the left side of the screen and just look at it, think about it. And on the right side of the screen, I want you to picture one thing you've learned to do or you could learn to do to help deal with the problem on the left. You've faced many problems in living with MS. Picture one thing you've learned to do that actually helps, that makes it better. If you're feeling fatigued, maybe you challenge it and you say, I'm going to go out and take a walk anyway. I'll view it as an occasion to train my body to be more active. If it's difficulty recognizing faces, how do you handle that? What do you tell people? You could say, I'm having trouble with my vision. If it's a problem with your balance, think about ways you can build up the ability of the muscles that are working well to help you keep your balance. Or admitting you need help and getting the additional physical support you need. But as your body is floating and comfortable, I want you to focus on not just what's wrong on the left side of the screen, but what you can set right on the right side of the screen. How can your brain and your body respond in a way that helps you, as you have in the past, deal with these limitations as they arise? So you use the hypnosis to acknowledge problem one at a time and your resources for dealing with that problem. And notice how if you had some discomfort, that in doing what you're doing, you may have actually reduced the level of discomfort by focusing on other things. Now take a moment to reflect on what this means to you in a private sense, and then we'll come out of the state of self-hypnosis by counting backwards from 3 to 1. On 3, get ready. 2, with your eyelids closed, roll up your eyes. 1, let your eyes open. Your hand float back down, make a fist open, and that'll be the end of the exercise. How are you feeling?
I feel really chill about, even though I was just like thinking about stressors, it was interesting to feel comfortable while thinking about things that are stressful and not have that pit in your stomach.
I'm really glad. That's the idea. You face it, but you say, I've got ways of dealing with this. I'm going to deal with it. And you give yourself the opportunity to feel I'm not being blindsided by something. It's something I have learned to deal with, or I will learn to deal with. And that makes you feel better about yourself. I'm glad. And how's your pain level right now?
It's good. I feel good. I feel comfortable.
Great. I'm glad to hear that. And before we go on to questions from others, you mentioned one other thing that a psychiatrist cannot ignore, and that's guilt. And I think it is very easy in this kind of a complex mind, brain, body problem to somehow find a way to blame yourself for something that is not your fault. And so what you want to do is build up your ability to address this and build strategies to respond to it, and not let yourself slip into blaming yourself for something that you don't fully control, but you're learning the best ways of dealing with it. And if you're doing that, no more guilt.
That's great advice.
Thank you. Thanks to both of you for that really nice demonstration. So I think we'll jump into pre-submitted questions, if that's okay with you, Ardra. I know you also had a lot of questions. Was there anything else pressing on your top of your mind that you wanted to ask the doctor?
I feel like I could ask 100 more questions. It's all really fascinating. I feel like a lot of it is kind of learning as you go also. So I'm really happy to hear the questions that everyone else has.
Well, there was actually a very interesting question that was asked while the two of you were doing the hypnotizability test from Martin. So this is a live question. So Martin asked, I have always wondered if a highly susceptible individual who was able to go into a deep somnambulant state what might be the outcome if a post-hypnotic suggestion was planted that they never had the illness in the first place, with the caveat that even if that was an ethical thing to do.
Yeah. Well, I don't think just like that it would go away, but it may be an illness like any illness is a combination of what's happening in your body and how your brain is reacting to it. And I don't think you can just instantly make the symptoms evaporate, but to the extent that we all sometimes do things that can exaggerate a symptom rather than minimize it or control it, it might be that you could come out of it feeling better. Now, I would not make a suggestion like that because I'd be afraid you'd hurt yourself. You're pretending everything's fine and, you fall or do something that could be damaging. So I don't recommend that. But I do recommend acknowledging and expanding your array of coping resources to deal with whatever is going on in your brain and your spinal cord.
Because it's not about denying that we have MS or pretending that we don't have MS, right? It's figuring out what tools we have access to treat it. And I would stress that pharmaceuticals do have a role in the management of MS, as do complementary therapies.
I'm with you on that. Yes.
You spoke to this a little bit earlier, but I just wanted to echo a question about balance when walking. Can hypnosis positively affect balance when walking? Dr. Spiegel, you talked a little bit about like mobility challenges in general. What about balance specifically?
Well, I think it's a good idea. You could use hypnosis to help you focus more on what you can do to both be more sensitive to situations where you might be at risk of a fall, and also to practice how you respond to a slight difficulty with your balance. So to be more sensitive to it as a sort of early warning signal and build up your body's ability to use the muscles you can use well to maintain your balance. So it's a matter of, distant early warning and ability to respond. And you can, I think, train your brain to detect threats to your balance and practice means of keeping yourself upright.
I think I would just also add, and maybe I'm just rephrasing this, but like, yes, balance is a real symptom, but my balance is better when I'm paying attention, when I'm really aware of it. And like, that can be exhausting, but less exhausting than falling down, maybe.
Yep. Well put. And that's where the intensity of focus in hypnosis can help you. That you can just practice literally, what is it like when I'm doing it well, when I'm really paying attention and protecting myself, and practice doing that. And that can be a self-hypnosis exercise to intensify your focus on maintaining balance.
Great. Thank you. And so besides the physical tiredness, do people with MS also get cognitive tiredness? You mentioned a little
100%. Like, I will answer that. Yes. And I would also like decision fatigue is so real. I have a fixed amount of decisions I can make in the day. And when my husband comes home and says, "What do you want to have for dinner?" there are times when I'm just like, I can't answer that question. I am so tired cognitively.
So just offload that one to your husband. That's the thing.
Great. Yeah.
Great medical advice there, Dr. Spiegel.
We're having Subway every day.
Gotta fix that.
So an interesting question regarding MS, if damage has been done, could that damage be reversed?
Well, in two ways, it's certainly possible. Some of the damage to the myelin sheaths of neurons, may not grow back. Sometimes it can, but it may not. On the other hand, there's a lot of redundancy in the nervous system. And so it's also possible that other neurons can learn to take over the work of the ones that are damaged. And the most striking example I've seen of that is there's a movie of a woman with advanced Parkinson's disease. So she has the tremor, the shuffling gait, the bradykinesia, not moving very much. And then they turn on her favorite song loud. And she just starts dancing down the hall, and the minute the music stops, she's back to where she was. So that's a message that sometimes we're just not using the capacity is there. We just haven't figured out how to use it. So there are ways around sometimes limitations, even if there is damage to parts of the nervous system. So you've always got a hell of a lot more neurons that are intact than you do the ones that are damaged. So some of it is maybe, finding new pathways to make things work. And it's not going to, fix everything at once, but sometimes it can help.
I wonder if also, and maybe this is getting in the weeds a bit, but in the relapsing remitting stage of MS,
Right.
if, when you've had an attack and you're in that recovery period, if it's maybe not a little bit extra opportunity for some new neural pathways, like if that's not a very good time to try and
I know. I think
implement
it
some of
is.
these strategies.
I think it is. And again, using the self-hypnosis to sort of explore, what's coming back now. So to
Yeah.
enhance, because your sensitivity is probably over-directed at new limitations. Oh God, this is happening.
Well, when you
But
wake up, and
Yeah.
you can't walk, and
Yeah.
then for a lot of us who have these high dose steroids to treat these acute relapses, it is like a night and day effect. So you are very hyper aware of that sudden loss and the sudden recovery.
Right. And but you want to be sure that you're paying attention not just to the loss, which you need to know about, but to the recovery too.
Right.
And so use it to focus on taking stock of what's coming back and to try and work on using that and building it as it returns.
Great. And what is the best way to advocate for yourself with specialists who dismiss what you're saying or feeling?
Find another specialist. Honestly, like if I think in 2025, if you have a medical professional who can't also accept complementary therapies or a holistic approach to managing your illness, that would not be the right position for me. I know it's not easy to find a new doctor, but I think especially with MS, it's a lifelong condition. It's a long-term relationship. You want to feel like your medical professionals support you. And yeah, I think more and more we just know that lifestyle choices can influence outcomes.
I would add to that, teach them. Now there are some dogs that aren't teachable, but there are many that are. And so to say to them, I've been living with this for a long time. Thanks for your help. But guess what I just did or what just happened? Or let me tell you something that really worked for me and might work for some of your other patients.
Yeah.
And sometimes, docs want to learn how to be better and do things better. And so you'll
I've
find some that
experienced
are
that.
interested. Yeah. But take advantage of that and tell them to try Reverie. It might help them too.
We could all use a little self-help hypnosis.
You bet. You bet.
We're coming up on time, so I want to thank both of you for this wonderful conversation and really insightful demos. Is there anything else you'd like to mention before we wrap up?
No.
Even an hour went by. It was really quick. So, I mean, I'm excited to keep using this app and to see what changes I can make for sure. Like Dr. Spiegel is on the app. It's your soothing tones and wisdom.
is.
I think it's really great.
It-
So, and like if anyone watching has questions for me offline or wants to share their experience of success, you can find me on social media. Like send me a DM. I love to know what's helping other patients also.
That's great. Well, thank you for what you're doing for people with MS. And everybody, you're welcome. We built Reverie for you. We want you to have an opportunity to make better use of all the neurons in your brain that are working to help you deal with the few that aren't.
Thanks so much, you two. And thanks, everybody. Have a great rest of your day.
Thanks. You all too.
Thank
Take
you.
care. Great to meet you, Ardra.
You too.
Thank you.